When I first meet a patient, I want them to know that I am very interested in explaining to them why they're coming to see me and why I can help fix whatever problem they have. Hi, I'm Chang. I'm a general surgeon at Riddle Hospital. My clinical focus is general surgery with a focus on complex abdominal wall hernias. Some of the conditions I treat are appendicitis, colon cancer, ventral wall hernias, groin hernias, and hiatal hernias. Now with the robotic platform, because I get 3D vision, I get dexterity, I can actually do it with 3 little cuts. It's a very important part of my practice because it allows me to offer them different types of procedures that I can do minimally invasively that weren't traditionally given before. I've done a lot of complex robotic hernia procedures. Using these advanced robotic techniques, we remodel the entire abdominal wall by releasing muscle tension and then also reconstructing muscles and the strength layers of the abdominal wall, in addition to adding a piece of mesh to strengthen the whole entire abdominal wall. My philosophy of care for patients is that I want them to feel that they're a part of my family, that I care for them and I care for their outcomes. I care for, even after I perform surgery on them, how they're doing. I see you 3 months after your surgery. I see you a year after your surgery. What's most rewarding to me when operating on someone or doing procedures on someone is how happy they feel when they are not suffering anymore from the pain, that I actually fix something and then they can return back to their normal activity and their daily lives.